So, we are super excited to be here today with Dr. Andrea Matsumura, who is an internationally recognized sleep and menopause expert. She's also known as the Sleep Goddess MD. She is board certified in both internal and sleep medicine. She created the D.R.E.A.M sleep method. D.R.E.A.M stands for Daily Habits, Resting Environment, Emotions, Archetype of the Sleep Goddess, and Medical Conditions. We will definitely be talking more about that. The Sleep Goddess Archetype is also her creation, and with it, she's redefining how women understand and optimize their natural sleep rhythms for better sleep and long term health. I think we can all use that. She became certified in menopause care through the Menopause Society after seeing so many of her female patients struggle with sleep issues, and we are very excited for this talk today. So, thank you so much, Dr. Andrea Matsumura, for being here. We really appreciate that.
Thanks for having me.
So, we always like to start off by asking our guests a little bit about your background. We would just love to hear how you ended up your focus being about sleep medicine.
I was practicing internal medicine for a large company, and what I found was that every person that I talked with at the end of their appointment, or even when I worked in the hospital, people just were not getting sleep, and it was an afterthought. And we'd sit and address all of the medical issues, and then at the end, it would a person would say, I'm not getting sleep. I'm not getting the sleep that I need. I'm really tired during the day. Can I get something for sleep? And as a dutiful primary care physician, I was handing out a lot of prescriptions to help people get to sleep. And I started to think about, why is everybody having problems sleeping? Started to dive into the literature and realized, okay, well, there's an entire field here that I didn't really understand. Got no training in medical school or residency about it, literally like 0 to 1 hours. And then I found out that there were fellowship programs. And in my 40s, I went back to school and I did a fellowship in sleep medicine. And then I quickly became the specialist for women because, again, another aha moment. Uh, Women were struggling with sleep more than men that I would find, and their symptoms were not being addressed, and they were being told, just try to relax more, or maybe you're just doing too much. And there were all of these symptoms that were, pointing to serious medical conditions, and they were not being addressed. So I ended up having a 6 month wait list at my last private practice for women to be evaluated. I quickly in the city and in the state became the sleep expert for women. And then I decided to start putting out education on social media, and here we are. Now I'm writing a book, and a book is coming out next year.
Congratulations. That's
Thanks.
wonderful. What's the name of the book, or does it have a working title?
It does. It's called When Women Stop Sleeping. It is going to be published with Macmillan Publishing, and we're going to go from menarche to menopause with chapters that are a little more robust around midlife. But women, my mission is to stop the normalization of the suffering of women through every stage of life and acknowledge the fact that we have a, a sleep crisis in our world. Basically, it's a global crisis.
Thank you for taking on that mission as someone who has struggled with sleep. We are also on a mission to help type C people stop suffering in similar ways. And a lot of type C people have sleep issues, not just me, issues both falling asleep and staying asleep. If you're someone who is taking the responsibility of the world on your shoulders and you're doing for everyone and you're giving so much of yourself, you just are naturally burdened and weighed down. And it's hard to unwind, it's hard to turn off. We're just curious if you see a lot of
patients in your practice that have these type C traits, this overgiving tendency, and how do you work with them? How do you treat them? How do you feel like these traits interact with their sleep patterns?
Absolutely. A lot of women do fall into that category. We've been trained to be that way. And somewhere around midlife, I like to say most women's F jar gets emptied, and then they realize that they need to pay attention to their health and to themselves. It's typically around perimenopause that women start to recognize that they can't do this anymore. And they try to do uh, things they take on. Society expects women to take on more than I think our counterparts when we are trying to juggle careers or home life. Uh, being a caretaker for all ages. And we that's why I developed the dream sleep method, because what I found, and no shade to my sleep colleagues, what I found though is that in the sleep world, because there's not many of us and we're trying to get through patients, there's a lot of focus on sleep apnea, but not on all the other things that are affecting people's sleep and your daily habits. Your sleep, how well you sleep starts when you wake up. And we have to address what's going on in your daytime that is then infiltrating your sleep. Your resting environment. What are you bringing into the bedroom that is not allowing you to wind down, get to sleep? Is your bedroom environment optimal? Uh, Emotions. What is going on in your head that you're bringing in to the bedroom? Archetype, I call that archetype, the circadian rhythms archetype. A lot of people have circadian mismatch. They may be more of a night owl and they're having to wake up early for either work or home responsibility. And then medical conditions. We are not recognizing the fact that over 50% of women in midlife will have sleep apnea. 9 out of 10 of them do not know that they have it. On the upwards of 30% of midlife women will have restless leg syndrome, and that is often not worked up. And then many women do have chronic insomnia, which I am calling it a syndrome because it's many things that cause chronic insomnia. And oftentimes we have to pull several different levers to help somebody retrain their brain to fall asleep and stay asleep.
So basically, you just went through what the dream sleep method is all about. So you were talking about daily habits, resting environment, emotions, the archetype of the sleep goddess, and medical conditions. And I just think, just like you also mentioned with insomnia, so I do a lot of what's you're very familiar with, I'm sure, cognitive behavior therapy for insomnia. And it's always so interesting to me when people, trying to figure out is it is it just sleep anxiety and that's leading to, physiological arousal and that's the cause of the insomnia? Is it underlying, as you talk about in this method, what are your daily habits? What's your resting environment? What emotions? What else is going on? What other medical conditions? So you kind of just described my evaluation that I'm trying to always figure out with, and it could be, as I just said to a patient yesterday, a little bit of both. So I think it's so important that you're expanding how we're thinking about sleep, because obviously that's going to help a much greater variety of people and also help people understand, because I think a lot of doctors or professionals may not look at it as a multifaceted approach. I would love to also just hear a little bit more about this sleep goddess archetype. Can you talk to us a little bit more about that and certainly just explain that a little bit more for us?
Sure. There are 5 circadian rhythms. 3 of them are pathological. 2 of them, excuse me, are pathological. 3 of them are just basically, are you an early bird? Are you a night owl? Or do you fall somewhere in between and fit into societal norm? We tend to be a little bit of an earlier society in the United States. There are there are places in the world where they're a little bit later, and then there are places in the world where they're a little bit more what we call advanced circadian, meaning more of an early bird. And I find that most people are pushing their bedtimes too late because we have a lot of light in our life. We use our phones in our bedroom, and we have effectively shortened our sleep time as electronic devices have become part of our life. And we are now a 24/7 society. We no longer have downtimes in our society. So we have to actually set that boundary and develop a downtime so that we can actually turn our brains off and prepare our brains for sleep. The three that the quiz focuses on is to identify whether or not you're an early bird, a night owl, or neither. On the upwards of 20 percent of the population globally, that's how many people are night owls. And a night owl is somebody who really wants to go to bed at 12 o'clock or later and wants to wake up at 8 o'clock or later. That's not really in sync, especially in the United States, with the kind of work structure that we have here. Advanced people or early birds really like to go to bed. Those are the folks who you tell them, "Hey, I have a dinner reservation at 8 o'clock," and they're like, "I'm out. I'm not doing that. It's way too late. I want to go to bed at 8 and wake up at 4. I want to go to bed at 9 and wake up at 5." That is an early bird. And then somebody who falls in the middle, in between, they're going to bed at 10, waking up at 6, going to bed around 11, waking up at 7. They are fitting more or less societal norm when we start work around 8 o'clock in this country, and we are ending our work day at around 5-ish, right? So the quiz takes you through a bunch of questions to help identify where you are at, because if you're not in line or in sync with your circadian rhythm, we need to start there, because you could be, so to speak, chasing your tail to get enough sleep.
That's so interesting. I'd love to just obviously you went through very quickly the dream sleep method. What are some of there are probably kind of classic things that you kind of regularly talk about with people. Of those five elements, what do you or components, what would you say are the ones that, you frequently feel like aren't obvious to people and are just really helpful to remind people about, or even, are things that like for someone with type C would be really helpful to hear?
Emotions, really. A lot of people feel like they compensate really well during the day. They're highly motivated, successful, professional folks. They're getting everything done. They're crossing all their T's, dotting all their I's all day long, and they don't realize that whatever that emotion is, that they're bringing that into the bedroom, and they don't make the connection. They'll say, I'm not really all that anxious. I get all this stuff done. I'm doing everything right. But then when they get into bed, they're thinking about the next day or this interaction that they had a week ago, and they're preoccupied. And that is a type of stress. And I want to be really clear. I tell folks, this is not just general anxiety. It's the kind of environment that we're living in currently that is this frenetic pace, and we're bringing it into the bedroom, and we're not leaving all of that outside of the bedroom. I will tell folks that they need to quote unquote sleep alone. And what I mean by that is write down all the things that are occupying your brain before you get into your bed, before you get into your bedroom, ideally. Doesn't have to be pretty. You don't even have to spell it right. You just, as quickly as you can, give yourself like 5 minutes or less, write all the things down, and then look at that piece of paper, tear it up and put it in the trash can, and then get into your bedroom or into your bed and tell yourself, I'm going to sleep alone. I'm not going to let those things bother me in bed.
I love that idea of sleeping alone and tearing up the paper. I think it's hilarious. But I want to go back to something that you said that was surprising to me, which was the statistic around 50% of women having sleep apnea, because I've had this long-standing chronic insomnia that started when I was pregnant with my first child. And I wake up in the middle of the night and I have a really difficult time going back to sleep. And I've tried every medicine, every alternative therapy, uh, everything you can think of, sleep hygiene, all of it. I did a sleep study where you go into the lab and they wire up your head, and it's a really wacky experience. But they did find that I had mild sleep apnea, which they didn't feel like was worthy of being treated because it was so mild. And I also maybe had a little bit of a cold then, so I didn't think too much about it. So I'm just interested in hearing more about sleep apnea for women. What does it look like? Is it, when I think of sleep apnea, I think of the CPAP machine, and that seems so drastic.
Mhm.
Is that how it gets treated? How do you figure all
Yeah,
this
that's
out?
one way it gets treated. I'm glad you're bringing this up because you are very common. This is a common scenario. Women do not present like men do. And I always say, hey, I am a midlife woman. I'm in my 50s and I present the way women present. I do not present atypically, so please stop calling me atypical. I'm presenting typically for a woman. It just isn't, it's not, it hasn't been studied to the extent that it needs to be in the literature, that it becomes part of the daily screening in a clinician's office. In fact, one of the screening tools that I talk about is called the Stop Bang questionnaire, and it is to address pretest probability for someone who may have sleep apnea. And the G stands for gender. So you are already losing a point because you're a woman. That effectively is going to leave some women with a low pretest probability, and then they will not have a study. Then there's a whole nother talk, and there's not a lot of data out yet. However, the way that the scoring system was developed for sleep apnea was really based mostly on men. And that was, all that scoring rubric was developed with men's symptoms and men's oxygen desaturations. Women desaturate differently. So on top of that, we are missing women. And I would argue again, you know, we need to start talking about these things, even though there's no solid evidence out there. I would argue that we need to start studying women's breathing abnormality because, in fact, you may have a mild sleep apnea on a sleep study. It might be a little bit, worse than we think it is because of how we're scoring it. And then two, I hear this all the time. When I have consults, people come in and say, well, I was told I kind of don't have sleep apnea. I have just a little bit and that it shouldn't affect my sleep. We don't know if that's true or not for women because women have insomnia, brain fog, fatigue. They're depressed because they're sleepy or they're sleepy because they're depressed. We don't know what's going on first, right? That's how women present. They don't have loud snoring. They don't have witnessed apneas. They're not waking up gasping. And, and so I hear this, and when people tell me, well, I was told I have, really mild sleep apnea and have a little, I kind of have it, kind of don't. And I always tell them, well, that's kind of like saying I'm kind of pregnant. Either you have it or you don't. And if you're having symptoms like insomnia, it's worthwhile to pursue treatment to see if that indeed is affecting your sleep because women also have REM related obstructive sleep apnea, meaning when we put somebody in a sleep lab, they will have clusters around their dreaming and they will have significant sleep disorder breathing during REM sleep, but the average overall is mild. And that's pretty impressive. And there aren't any great long-term studies that say we should be treating these folks it's happening mostly in women. So we don't, it's worthwhile to pursue that treatment if you're quite symptomatic for a woman. And then the second piece you asked about treatment. CPAP is what we know the most about. It has been studied the most. It's basically a compressor that's giving you room air that's compressed to open up the back of the airway, the throat. There are oral appliances, though, that are great options for women who have mild or moderate simple obstructive sleep apnea. And maybe you need an oral appliance with a combination of positional therapy. We have to get creative. It's just that insurance has kind of dictated how people get treated, and CPAP is generally always covered. However, whatever your insurance covers, and that may be 0, it might be 100%, who knows? Oral appliances aren't always covered, and they can be cost prohibitive for people. Uh, uh, Positional devices are rarely covered, and that might be useful for women. It's just sleep medicine is, I want to say it's about 60, 65 years old. It's not very old. And where our data is for women, it's where cardiology was about 25 years ago. We have a lot of catching up to do.
And what's frustrating is how preventative all of this is. If we can get our sleep right, our health improves by leaps and bounds. And so when we hear things like insurance isn't going to cover the appliance, it's just like, I want to tear my hair out. Maddening.
100%. Yes. Yes.
I would just love, just as a follow up, when you say positional device, is that some sort of appliance that puts you in the bed a certain way, or
yeah, there are a couple of FDA approved devices that are a little cumbersome. There's one that you put around your waist, and it has a big foam cushion in the back so that you don't roll onto your back. There's actually a little device you can put in your ear. It is, I believe, FDA cleared, but that is not a device that's going to be paid for. It's difficult. There's a lot of, we're not really thinking, being creative to help our patients. I think many of us will say, hey, these are the things that we know that are covered, that we know we have the most data on, and then we kind of focus on that, and we don't tend to be creative or think about ways to treat mild sleep apnea, especially in women. The data is not out that says we should be treating mild sleep apnea. And in fact, a lot of insurance companies, because moderate and severe sleep apnea, let me stop there. Moderate and severe sleep apnea do have there's a proven increased risk for heart attack, strokes, and neurocognitive issues. In the mild setting, we know that it may or may not. The jury's still out. There's no evidence yet saying that it is going to be an increased risk factor. However, we need to do that studying, those types of studies in women, because maybe in women, mild sleep apnea, depending on the type of sleep apnea that they have, maybe that is enough to cause an increased risk, because we also know that when you're not getting enough sleep for decades, that poses an increased risk for heart issues, metabolic issues, brain cognition issues, memory. So we have some work to do.
I would say, unfortunately, obviously this is not always the case, but I think stereotypically women suck it up more and also get dismissed more, which actually brings us to the next question that I wanted to say, which is, in addition to sleep, we're so excited that you have also become an expert in menopause, something that also is just, I think, a very new field. And I'm so happy that now we're past the 90s and the study that, stopped it all. And people are realizing that there's so much more here that can be talked about and dealt with and worked on. So would just love to know a little bit about, how that came to be, that you started focusing more on menopause and, you know, for so long. I mean, I actually, like, I experienced it myself, the transition. A few years ago, I went to my gynecologist and she said, oh, you'll have to go to a specialist to talk to menopause. And maybe that was like about 4 years ago, 5 years ago, or maybe 3 years ago. I can't remember. Part of my menopause. And I just recently went to see her, and immediately she was like, oh, I know you mentioned last time your sleep wasn't going well. Would you like some progesterone? Because I'm already on the patch. And I was like, this is great. I'm so happy. She's more willing to talk about this. She's, going in this direction. So anyway, would just love to know a little bit about what made you make that transition.
Part of it was I was seeing a lot of women in midlife who were being told, who were being dismissed, told that there's nothing that can be done. And when we got right down to it, many women have, I rarely see somebody who has only one sleep issue going on. And again, why I developed that dream sleep method, because typically I'm seeing somebody who has at least two, if not on average, four things going on that's affecting their sleep. And many of these women have symptoms of sleep apnea and don't know that they have it. And it is affecting their life greatly. And you do not have to have, you don't have to have an elevated BMI, body mass index. You don't have to be particularly overweight. And I started carrying tissues around with me, uh, going to every consult, because once I got down to all the things that were affecting a woman's sleep, they literally would break down and cry and say, I have been struggling for a decade and nobody has listened to me until today. And I've been asking for a sleep study for 5 years and nobody said that I should get one. Everybody kept telling me that it's not sleep apnea. And here we are talking about the fact that I have mild sleep apnea. I may have restless leg syndrome. And, my resting environment I could work on, all of these things. Um, and so I started to really shift and focus. And, I've been practicing menopause care since I started practicing it, which was I graduated from medical school in 1999. So I've been kind of practicing it, but I thought, let me get certified so that people really understand that that is my focus, is midlife and women's health and sleep. And it is I would say maybe there's a handful of sleep docs who are really only focusing on midlife and women's health. And we're it, this un it's the territory is yet to be, well established, and we need help. And my own menopause story, I started having sleep and I'm thinking, all right, the sleep doctor's having sleep. I used to be able to sleep anywhere, anytime, any place. And now I'm waking up in the middle of the night. What the heck is going on? And it took me 4 clinicians until I finally got started on hormone therapy. I was having palpitations. I was waking up in the middle of the night. I had anxiety that I had never had. And I had one clinician tell me, well, you've had a good 50 years. Yeah, you've had a good 50 years of no anxiety. Are you kidding me? Really? Yeah. So
Yeah.
I took it on. I said, you know what? This has got to stop.
Well, as someone who suffered for a long time, I just want to say thank you for being a pioneer. I feel like if I had met you 20 years ago, then maybe I would have saved myself a lot of pain. But it's just so wonderful to hear about people that are taking women's problems seriously, that are supportive, and that I think most importantly have this holistic view of it's not A, then B. It's not this linear thing. There are multiple complexities feeding into these issues that we have. And we have to take this holistic approach. And we do have to be very creative and try out a lot of different things. If there's anything that supported me through, getting on a path to better health, it's just experimenting and trying things. And maybe they didn't work, but that's fine. And we can take some information from there and feed it into the next idea. So just a big thank you. I think it's such important work. And when we all sleep better, we're just going to be more peaceful and better parents and better coworkers and better spouses and better everything. It's a huge
Healthier for
relief.
ourselves.
And better,
Healthier.
exactly.
We'll be
Exactly.
healthier. Yeah.
Healthier. Before we wrap up, we just have two sort of more fun questions that we always like to ask our guests. And so the first one is, what do you like to do for self-care? We're always looking for ideas that can help people relax more, have more fun, do things that are more restorative. So what do you love to do?
To help myself get to sleep, I usually I love a good comfy pair of pajamas. I no longer try to look cute. I want to I want to feel comfortable. I usually do that. I love a good eye mask, especially during the summer. If people need earplugs, I tell them get a set of earplugs. I like to spray lavender on my sheets before I go to bed. I invested in nice sheets and a very comfortable pillow. And that's going to be different for everybody. There's not one pair of sheets or pillow that is going to work for everyone. And that's how I get myself to sleep. And I really try hard to leave my phone outside of my bedroom, or I put it in the nightstand. But I have made a point of not not putting it in my bed with me. That is the worst. Even if I bring it into the bedroom, I put it on the nightstand before I actually get into bed.
Yes, that is the number one thing that I find is unfortunately the most challenging with many people nowadays and their sleep. So the other question we always like to ask our guests is, do you have any books that you really recommend? I think it's so helpful to have some good resources in addition to all the things that you're saying. But are there any books that you highly recommend?
I really love the books on menopause right now. There's so many books out there, and I think that for many women who are in midlife, building your own library on menopause care is going to be essential. My dear friend, Dr. Mary Claire, just came out with the book, The New Perimenopause. She also has the book, The New Menopause, that has come out. And I really recommend those quite a bit. There is a book if you're having trouble sleeping, and we've figured out that it's chronic insomnia, and it's a workbook. It's called Overcoming Insomnia, a Cognitive Behavioral Therapy Approach, and it's a little workbook. I also developed a toolkit, which is a small, it's the start of how I practice treating chronic insomnia. Just a little plug around that. I agree that cognitive behavioral therapy for insomnia is the number one treatment. However, when you take a deep dive into the literature, did they really focus on women? Did they focus on midlife women? No. Okay. And I combine acceptance and commitment therapy with cognitive behavioral therapy for insomnia. And there's a handful of folks who are doing that. And maybe people are kind of doing it informally, but I'm formalizing it and making it a true combined therapy. And I think that really helps the anxiety that is developed when people start to go down the path of CBTI. It can actually raise anxiety. And that ACT combined with CBTI is really a winning combination to me.
I am so glad you said that. So usually I just mention CBT because that is the prescription. That's the first line of treatment. But I'm an ACT therapist, and I have found so many people who come into treatment and their anxiety has actually gotten worse because CBTI has all these very rigid rules.
Yes.
So I really specialize in ACT, but I always say that, I do CBTI, which I do, but that's really to get people in the door because that's what they come to see me for. But for those of you who are like, what are they talking about? There is one of the key tenets of ACT is psychological flexibility. And CBTI is a wonderful foundation, but it can be presented in a very rigid way, and that can increase anxiety. And that is not good for sleeping. So I'm so happy that you are promoting this because I don't actually think acceptance and commitment therapy gets enough
Bad.
and I actually was just talking to a patient yesterday about Sleep School, which is run by Guy Meadows, who's a big acceptance and commitment therapy for insomnia proponent in the UK, and it's the app that I actually recommend the most. So I'm so happy that you are encouraging people and trying to work on that. So before we wrap up, we just want to say thank you so much for your time today, but we also just want to help people find you. So are you taking patients currently? How can people seek you out? What is your website? What is your Instagram? How can people find you?
I actually am working for a national company. I'm working with them as a national advisor to help roll out sleep services for women. That is how I see patients is through Monarch MD.
Okay.
So that's how I'm seeing patients. I have a website. It's Andrea Matsumura MD. .com, and then my Instagram is Dr. Andrea Matsumura, and I throw out little tidbits pretty much every day.